All right, everyone. This is our 10th Health Talk for Citizen Health. And the topic of today is Humantiv and our upcoming beta release scheduled for August the 15th. And we're going to talk about what it is and what you can do with it. So first of all, if you don't know what Humantiv is and what we're trying to do, it's starting off as an app that you connect your wearables of choice, such as a Fitbit, an Apple Watch, Garmin, Misfit. We have a long list of health trackers and wearables that you can connect. And we take that data and we are calculating a health score for you. And if you increase that health score, you can earn our cryptocurrency, Medit. The idea here is we're trying to motivate you to do healthy things. Get more steps throughout the day, get better sleep at night, take the stairs more often, really just be more active. And the idea is if you're more active, you're generally going to live a healthier life. Like today, I haven't been inactive. I've been sitting down, didn't work out this morning, had terrible sleep, and the health score on my Humantiv app is absolutely terrible. Probably the lowest it's been since we've been testing it out. Especially with the red scores on there, it definitely lets you know that you're doing something wrong. But the idea here is to quantify your activity into something you can measure, and by measuring that, you can improve it and be rewarded for doing so. And with those rewards, you can go to our marketplace, which we are developing called Metaplex, and you can purchase health and wellness products. Originally, like probably within the next 6 months, we're going to have our marketplace open for health and wellness products such as meal delivery services, vitamins and supplements, purchase wearables, Fitbits, Apple Watch, athletic clothing, stuff like that. You'd be able to purchase with Medit as a discount, kind of like a discount token. And later on down the road, probably starting in 2019, you'll be able to purchase health services such as a visit to a doctor, a telemedicine visit, or get a discount on a particular procedure. So really cool stuff. So kind of I want to walk everyone through what it looks like. Starting with, let me back up a little bit. Let's talk about our beta test. So starting on August the 15th, we're going to have Humantiv ready to download in the Apple app stores and Android. And you would search for Humantiv to find that, and it's pretty straightforward. You just download it. We're using multiple APIs to connect to your wearable, and once you do that, it's pretty straightforward. You don't have to reconnect. It'll pull all your data that we need to calculate this health score, and then it will look like this. You see that? You see a Medit balance.
Is it going to be in the beta version? So are we going to have to go through test flight to get it, or will it be actually in the App Store as Humantiv?
It's going to be in the App Store. Download it.
Okay.
Matter of fact, it's in there now and for Android, and it's I'm trying to the actual status. It doesn't say it's in beta, but it says Humantiv unreleased. I don't know if you can see that. This is actually in the Play Store. They really need to change that name. But it says unreleased, and there's a lot of apps. Matter of fact, it says unreleased app installed. It lets you know that this is unstable, that it could crash. A little disclaimer. So yeah, it'd be just like you're searching for Facebook in the App Store. Just download it that way.
So actually, I can answer Kim on that. So right now we're actually going through a test flight test. It's kind of local, but for you guys, like on the 15th, it is going to be tagged as beta, but like Brandon said, it will be on the store as a normal app. So you won't have to go through all that test flight stuff.
How does that look built in the iOS App Store? Does it specify that it is in beta or unreleased?
Well, today it's not actually on the store because it's a beta. We're doing it as a beta, so you have to go through test flight. That's what Kimberly Cannon mentioned. Yeah. It's a separate pipeline, that Apple uses for beta for apps that are not released. So that's what we have right now, but it's all internal. So on the 15th, it's going to be on the store as a normal app.
Okay. Yeah, because I've done beta testing with test flight several times for some other apps. That's why I was asking.
So Nabil, is it going to be specified as any type of unreleased I guess, description? Because I know on Google Play, they have a lot of apps that you can search for that are in beta, so to speak. And it says that. I was wondering if Apple does the same thing.
Now, for Apple, we have to decide if we want to do it through test flight as a beta, which means it's not going to be visible to everybody, but only to the people who registered. Or we can, if we open it to everybody, we can tag it as beta and then have everybody use it, but knowing the liability. So it's going to depend on what you decide, Brandon. Like if we want to restrict it to the people who subscribe, then we will have to do it through test flight still.
Okay, it's something we got another 4 or 5 days. Get some more people to sign up and register and see what we're at now. We're probably at close to probably 80 or 90 people have signed up. I'd say that's a fairly good number. Probably, I need to get an exact number, but I'm thinking 65 to 70% have been with Fitbit as their main wearable. Another 25% or so, 30% have been Apple Watch, and a couple, some other ones thrown in there, mainly Fitbit and Apple Watches. And there've been quite a few people now. I think I've sold probably 5 different Fitbits to people, like sold. Actually, people said, "Hey, I don't have any wearable. What do you suggest?" And I'm partial to mine, and sold them on that. So you're seeing a lot of people just becoming interested. They've been interested in just tracking their activity anyways, and now there's an option to get a score from that and earn money for that and compete with other people with that. So it's pretty neat. It's going to be fun to see how it plays out. Now, starting off with this, like I mentioned, we're starting with 3 basic measurements or 3 basic data points, which is your steps, your actual steps, like any old school pedometer can pick up, and your sleep, the hours you sleep, and your active minutes. Now, Bill, do you want to chime in here and add some insight into how we're calculating this score and what that's going to look like, and kind of everything you've been working on?
Well, so there's 2 different things. There's the score, the health score, and then there's how many minutes you get from each of these metrics. So like Brennan said, we have steps, we have minutes, activity, active minutes, and then sleep. So the score is a combination of all of them. So we're still kind of working on making it a little bit more accurate, but eventually it's going to grow to other metrics, including blood pressure, heart rate, etc. But for now, we're using those 3 metrics to figure out a health score in between 0 and 100. And then that health score is a daily one. So every day you're going to have your health score, and you can compare it to yesterday. And then you're going to have something that's kind of general, which is the combination of all those scores. And that's what the big, I don't know if Brandon can show that, but it's the big number that's shown there. And that's the one that varies, but varies slightly. The healthier you're getting, the better it's going to get. If you don't exercise one day, it's not going to differ a lot with the total health score that you had yesterday, but it's going to be a little lower. So each metric, we have something called the healthy maximum and minimum, and we have the maximum and minimum of each metric. So the human body cannot, for example, sleep more than 24 hours a day, and then you can't sleep 0. So those are like the maximum minimums. But for steps and activity, we have the same thing. And then you have the healthy ones that we decide are healthy. Right now, we're kind of having one generic kind of rules for each one of those metrics, like the minimum, maximum. But the users are going to be probably during this beta decide what journey they want to take. So you can decide, for example, I want to compete like an Olympian. I want to be as healthy as an Olympian. So in that case, your minimum and maximum are going to be different from somebody who's just trying to live healthier to be able to play with their grandkids. So you basically customize your journey, and from there you get specific boundaries, and you have to stay within those boundaries for as long as you can.
I like it. And
on this.
Like you mentioned too, we're starting basic. We're starting at the foundation of just tracking sleep, your active minutes, and your steps. Our next phases will be connecting data such as from a blood pressure cuff, wireless scales. We can import your 23andMe data, your genetic data, your microbiomic data. There's options to import all your EHR data and really build a comprehensive record of your health and put it all in one place and see how that trends over time. And also carry your data around with you, because really up until now, there has not been an app where a person can take all their data, aggregate all their data, and really quantify a score for their health and take that with them and try to improve and share that with a physician. This just hasn't been done before. It really hasn't been possible before. But now that's what we're looking at. And I've been getting a lot of really good feedback from people wanting to take control of their health data, because I think it's becoming known that other people have our data and they sell that data. They exploit us for our data, and taking that power back and giving people the ability to put all their data on their phone and use that health data to benefit themselves. They will sell that data to research groups, and they can track that. They can permission it out however they see fit, or however that looks. But the idea is to put that power back into the person's hands. So a lot of plans for this. I'm anxious to see how it's going to look for genetics, and you start looking at different propensities for different types of disease and different things that could affect you later on in life, and how that impacts your health score and how all that looks. So this is going to be a fun app. I mean, this is something that scratches my own itch. I like motivation, being motivated to go to the gym, motivated to go work out and get better sleep. And just by doing this over the past month, we've been testing this. I mean, it's addicting. A lot of times I'll be charging my Fitbit over here, and I need to walk outside to go to my truck or something, and I will literally get halfway out the door, and I'm like, no, hang on, let me go back here and get this Fitbit so I can get credit for this. Now that could turn into a bad thing. It could be like a Black Mirror episode, but I do think that people will become more aware of what they're doing. I mean, for instance, ever since I've been thinking about Humantiv, and before that name was even a name, I've always tracked my activity. Starting January 1st, 2017, I actually been wearing this thing. I've been tracking it. And I mean, it's pushed me to go park further out in the parking lots so I get more steps in, to always take the stairs if it's 3 floors or less, to try to get better sleep. That hardly ever works, but I still try, just because I'm tracking it now and I can see it. It helps a lot when you actually see what you're doing, because if you don't know what you're doing, you really can't improve it because you just don't know. And a lot of people recently have been chiming in about how their Fitbit has helped them live a healthier life. And John, I was going to ask you about that. I know you mentioned that earlier. I saw it in Slack. Do you want to shed any light on that?
Sure. I'm about not quite 2 weeks post-op from pancreatitis and gallbladder surgery, lap chole. Make a long story short, been having some belly pain, and on a Thursday night, I went to bed. It was pretty relentless. And about midnight, I woke up, and just as a habit, I have an Apple Watch, and I looked at my heart rate. It was 133, which is kind of fast for somebody that's been asleep. Looked at it again a minute later, and it was at 80. Another minute at 140. That's when I got a hold of my wife and reached over and said, hey, I think we need to go to the ER. I'm having some heart arrhythmias. And obviously that turns out, with going into the gory details, related to the pancreatitis and probably a blocked common bile duct, and subsequently found, as my surgeon so politely put it, looked like you had a bag of marbles, and one of them was about the size of a favorite shooter. So, yeah, I owe it to the Apple Watch. Obviously, I confirmed by putting my hand on my chest, but it was definitely a very positive, outside of using it for doing all the things that Humantiv is going to measure. And kind of my own little story, I started doing Fitbit back in November of 15, and I know exactly the situation. I don't know that my Apple Watch has ever charged to 100%, because I'm always doing what you do, Brennan. Yeah. Wait a minute. How far is this going to be? Okay, I can't add in manually, but yeah, same thing. So I think it's definitely driven me to take better care of myself. Again, all the things, the steps, the sleep, certainly the active minutes, which is kind of sad because I haven't gotten on the elliptical in about 2 weeks for obvious reasons. I lost enough weight in the hospital and I don't have to worry about it.
So, John, hearing what you're telling there, I mean, like coming to chime in onto, like, say, the physician side of it, okay? Like, to the physician side of it, people have been telling people not to eat fat, and people with low fat intake, low fat intake. If you have low fat intake all this time and you don't have the gallbladder contract, when you don't have the gallbladder contract, then the stones form. I'm just chiming in just because you told the personal story. I mean, we can talk offline as to what might be the cause. I mean, but let's go back to Humantiv.
Needless to say, I'm not worried about it anymore. It's gone.
Yeah, but these are some of the things that I see a whole lot of benefit with Humantiv because, I mean, let's just think about some type of post-op procedure, something that you need to follow the post-op guidelines and the protocols to not to have a problem to be readmitted, basically to heal correctly. Orthopedics for one. So you have a knee surgeon, you have to go to physical therapy, and you have to adhere to these types of physical therapy routines and whatever that looks like. The last 2 doctors I talked to, or not necessarily, one of them was a doctor, but the last 2 people I talked to, he said both were talking about this idea of paying people in Medit to adhere to these protocols and procedures after surgery. So basically, you're paying people to keep on track and to keep doing the right thing. Because a lot of times people, once they get done with surgery, they just won't take their medication, won't take antibiotics, won't do whatever, and so have some issue and they have to come back, be readmitted. Well, having something like this with Humantiv, where you can start tracking your blood pressure, your heart rate, and your steps, your activity, and whatever else you're trying to track, and structure that in a way where the doctor, the surgeon, can follow up and monitor their activity and push them to, I guess, stay in line and do the proper things. Now, that wasn't necessarily something I was thinking about as a big use case, but he said that's huge. Like, just having something like that, just for orthopedics, the post-operative procedures and protocols, and that's huge. So that's something we're going to be looking at. I don't know if anybody else has something to chime in on that. But seemed like a good idea to me.
Brendan, are you familiar with a company called PureWell? They are focused on orthopedics and they set these protocols. So that'd be worth a look-see at that. I haven't looked at it lately. You remember the guy I told you about that I met for a few minutes in San Francisco, Mike Ryan? He's on the board of PureWell. And there might be some, synchronicity there to at least to some point. But that's, I agree with what you're saying. I think that's got a lot of potential. A lot of potential.
Mm-hmm.
So, the whole end game of all we're trying to do here is to be healthy. Mm-hmm. And if you get paid for it in addition to that, that's great. But the bottom line is get healthy, follow the protocols post-operatively. If you do that, you're going to heal faster and you're going to remain healthy. If you do that and get paid in Medit, hey, love it. Mm-hmm. Sorry, Kimberly.
Oh, you're fine. No, I was just going to say I'm a registered nurse before I turned into a full-time professional patient. And I can definitely see this turning into something really useful for, decreasing readmission rates. Definitely like with CHFers, tracking weights, tracking, doctors can be watching and saying, hey, they're up 5 pounds. We need to get them in here. I can really see that even with AFib, you know, all of those chronic conditions, I can see this really being useful.
I can tell you from practical experience, particularly with CHF patients, when you do your nurses do their routine call to the patient at home, and they ask how their weight is. Oh, it's fine. Well, has it gone up any, down, blah, blah, blah. And the next thing you know, when you put boots on the ground and you send a nurse to the home and there's not a scale to be found, yeah.
Exactly.
So,
yep.
You know, somebody's not telling the truth.
Yep.
Hey, Brennan, this is Connor. I know that I'm a video up, but I was going to talk a little, about the I missed some of the orthopedic question about, I guess it was about rehab or something protocol. But I do have a guy right now. I've got a buddy of mine right now who is an internal medicine doctor. He's in Austin, and they're doing this in Austin. I don't know the name of his group. They're doing a form of this in Austin, but like all they do is they contract on like a direct payment contract with surgery groups, and they're internal medicine doctors. So like they're not. I don't know. I forgot exactly, but I don't think they're charging insurance. I think they're getting paid on a per member per month basis, essentially, or per patient per month basis, and they're doing all the perioperative work around surgery. They're focusing in orthopedics. Like my buddy is from Jackson, and he was just wanting to be home, so he's moving back to Jackson, trying to start the same thing in Jackson with trying to focus with orthopedic doctors and try to start. Essentially, he wants to start his own clinic and essentially have all the preoperative and postoperative checkups and managing diseases through surgery and things like that, on a direct care basis. And then he wants to build it out into all the perioperative procedures, rehab, rehabilitate, postoperative rehab, and all that, kind of have it in one place and be like a perioperative specialist essentially, but using direct payments and direct contracting. I don't even know if that had anything to do with your question, honestly, because I've missed some of it, but something kind of cool. It seems like it pertains to this.
Yeah, I would like to talk to him. I mean, what we're getting at is really gamifying the healing process.
Right.
Get down to it. I think there's a lot of different directions we could take that, but it's something we'll explore later. I mean, there's so much to this. I mean, we're tracking people's health with wearable technology, and we are rewarding them to improve that. So there's a lot of different use cases we can use for this. And Connor, we've talked about it before with employers, just their wellness programs. It still hits me that you mentioned they have a whiteboard. They literally take their Fitbit and write their steps up there. Completely a manual process. So, I mean, we can automate that and just have a really cool app for their employees to look at, have a leaderboard, have rewards they can purchase through our marketplace. We could make it fun for a lot of employers and actually give their wellness programs, give them a return on their investment.
Yeah, I was talking. Yeah. Can y'all hear me?
Yeah, I can hear you.
Okay. Yeah, I was talking to another friend of mine that works at Springbuck, which is, we've talked about them. They do health data analytics for self-employed companies. They take their claims data analytics, trend it out, and down to the belly button. But I was talking to them. My buddy, a guy that I went to college with, is the chief technical officer. Well, I don't know what he is, but he's their head tech guy. And I was talking to him a little bit about this. He's from Mississippi, lives in, I guess, Indianapolis now. And he was telling about, I was telling him about this and how we could integrate with them and our data analytics with their data analytics and kind of figure out a way to combine that information and really be even more targeted and more specific towards these employers. And he was like, man, that blows my mind. I need to set you up with him, man. I need to connect y'all.
Yeah, definitely.
Steve, he's done. He actually developed a technology, I believe, that allowed a company to take in data from multiple wearables.
What was the name?
The name of that company was originally Strap.
Hang on, what was it?
Strap, and then he sold Strap, I think, to Springbuck.
I thought it said Strava.
No. No. That would be a big deal.
Yeah. Yeah, I remember us talking about this a while back. Yeah, I would definitely.
And I'm just gonna do it. I'm sorry. I'll do that this afternoon. I'll see if I can't connect y'all and see if we can't get something going.
Okay, sounds good. Yeah, I'm excited about this because this is one. It is the first app. Once we do take this live, and we are issuing cryptocurrency, this is the first app that takes somebody's activity and generates a cryptocurrency from it. There's about 4 or 5 that are promising that, but nobody has anything developed yet that's live. So we will be the first company to do this. And based off of everything that I've seen, I've read a whole lot on the top 10 companies out there that reward users for activity in terms of just points or just like a simple leaderboard. And people are eating this up. I mean, you got Step Bet, Diet Bet, you got Sweat Coin, Achievement. I mean, there's a lot of them that I've been testing out. Half of them are garbage, but some of them are very good in terms of they just track steps and they give a leaderboard, and people are competing for this. I mean, there people are actually doing this, and the comments, I've been going through Reddit and just reading all kinds of comments, and something as simple as this is changing people's lives. I mean, countless comments, people saying, I've lost 50 pounds, I've got off the couch, I've been more motivated, I've quit smoking, I've quit drinking. Kind of mind blowing. You start reading some of these comments. So I do think that this could be something that could really make an impact on a lot of people's lives. I mean, it's fun. People can start competing with each other, which is kind of leading me to what I'm going to get to is the leaderboard. This is something that will not be live on our beta. We have talks of doing it over the next few months. But imagine just the leaderboard, having like a global leaderboard for Medit earnings, where either you can have your real name or a pseudonym or whatever username you want, but you just own a leaderboard. However much Medit you earn today, that's going to put you on a leaderboard for the daily earnings, the weekly earnings, all-time earnings. And you can segment it off. And I really think this is going to be big, but you can create teams. For instance, I think the medical personnel would be big with this, especially nurses. I know nurses get 15,000 steps every single day. So now you could have like different floors competing against other hospitals or different floors. I mean, because think about it, and I've asked my wife this, she's a nurse. The more you walk it kind of signifies that you're a better nurse because you go into the rooms more to check on your patients. So, I mean, it kind of be a bragging right that you walk more than your fellow nurse or something. Plus you're earning cryptocurrency for it. So I do see different types of groups start forming where they can kind of break off and have competition saying, well, let's put money into the pot, and whoever wins, whoever gets the most steps this week gets the pot or something like that. So I see a lot of different dynamics opening up to really just create games within this, but also to start generating real cash, like as far as real USD from this based off what I've seen on StepBet. Interesting concept. Check them out if you haven't. But for instance, they put in like $40 per person to the pot, and say that the goal is, let's just say it's 70,000 steps for the week, and the people who hit that 70,000 steps, they get to split the pot with everybody who hit that. The people who didn't hit that goal, they lose their money. They lose their entry fee. So all that money that gets contributed gets dispersed out to people who did reach them. So, I mean, I could see us doing that and start generating revenue fairly quickly. It's just a competition. Who doesn't like competitions? Especially if you look at the CrossFit crowd. I know we've talked about marketing to the CrossFit crowd, or really just people that already compete on a daily basis. And competing in an active environment. Really kind of, it's almost endless opportunities for this. So I'm kind of getting off tangent there, but that's some of the thoughts we have as far as developing out more fun into this app and more integrations with other different type of people, not just people that start bringing more people to this, not ones that already are tracking their activity, but people that have never worn a wearable before. This is a good way to get them motivated to start being more active, because now they have their friends competing, betting, kind of calling them out, wanting to bet and play them. So a lot of different use cases you can start thinking about. If I have any comments on that, because I think more and more I think about having a global leaderboard to see everybody, just one long scoreboard. I think that's pretty neat.
Well, I mean, early on with my experience with Fitbit, I got involved with about 10 folks, friends and friends of theirs, and we would do weekly competitions. So, I mean, it's just human nature. Human nature. Mm-hmm. There was no reward, though, other than I won or I almost won.
Yeah. See, that's what I've been looking at all these apps. It's just like that. I mean, it's just bragging rights, which is that's big. Bragging rights is always good. But it seems like they're just missing a huge opportunity. They just let it die on the vine.
I just love the fact there's something here for everyone. It could be your peers. It could be people that really need to get more active and back into the game, especially when you've been sitting for a while. So there's opportunity here again, just for everybody. But I think that the fun plus the functionality of what we're trying to achieve here, and then just getting more just value out of your wearable. So it's almost like if you go out and you don't have a wearable, you buy one, and you start to earn Medit. You've just paid, it's virtually paid for itself once our app starts to scale up a little bit here, because what you'll be able to do with the Medit itself is going to change the game. So just that value. And in fact, even getting kids involved. I'm a mom. I want to get my kids involved in this, because it's they're out, they're walking at school, they're at recess, and that's just more ways for them to focus on their activity, but then they're also earning something on top of it. And I love that it knows really no age barriers here or ability, and because your health journey is personal to you, and what you want to achieve, and even if that's just to move a little bit more, we can help you do that. And that's the bottom line. It's just we're so sedentary at this point in our lives. Now it's the time to really decide that health is fun, health is cool, and gamify it, engage with it, and the rewards will come back to you now and in the future. Longevity should be a goal, especially with all the genetics and everything that's going to come up here. You could conceivably live a long time. People are saying maybe 125 kids born today, maybe into their 175. I mean, that's out there on the fringe, but eventually that could be our realities. So now you would be considered even just a baby at 70 years old, and that's huge for our society, and what that's going to mean for our lives and our kids, or to see your great grandchildren could absolutely be a possibility here. But if that sounds cool to you, now's the time to start to take advantage of it, and we think we can help usher some of that in at the very tip of the iceberg. It's quite neat.
I do agree, Megan. I think this could catch on with kids, because I remember Ben, he was telling about his kids with what was the name of the band that he was talking about his kids? UNICEF. UNICEF had their band, and he said his kids were just running around the table, just trying to rack up those steps and beat their friends. I mean, that was, I don't know, like 8-year-olds. Right. And that is innate. And just like you said, John, that's humans. People always want to compete. People always want to one up their friends. And if doing that makes you healthier, great. Yeah, but once again, I'm seeing a Black Mirror episode here. Some people might take it too far. Of course, there's no stopping those people. They're going to take it too far with anything.
Yeah. That's the thing.
Warnings. Hey, you're killing it. Slow down.
That's why we have disclaimers.
Yeah.
You have to, and that's the thing too. The goal is health, and of course, you can push anything to the extreme. So, of course, reminder, when you're using our apps and engaging, with our services, we want you to be safe and we want you to be healthy. This is something that is for you, and not to be used as something that would go to hurt you. So we are very big on that. We want people to succeed, but in ways that are physically healthy, mentally healthy, and of course, anything can become addictive. So we want to make sure that when you're engaged with us and Humantiv, that you're doing it in positive and healthy ways. So that is a big deal.
I think by doing the health score and trying to come up with the health score, I think we should be able to start teaching doctors how to prescribe wearables and instead of medications. I think that has to be one of the goals, like going or bringing on doctors and teaching them how. I mean, like I would be wanting to be involved in developing this score. You know what I mean? And if your development team want to talk to me and I will want to work with them to try to see how they are doing it. And once I get involved, I think we should be able to develop a doctor's version of it and then try to figure out how we can really do it. And then we can integrate different apps into this and different technologies and techniques.
Yes,
I think you're exactly right.
And that's what we need, Dr. Ali. We need a lot of physicians to come together and say, all right, we're going to build an app that we can prescribe to our patients so we can monitor or help them with their health. And it's got to be, you got to be able to trust it, because there's a couple health scoring apps out there, and I'm testing one out you just sent me there. And if you don't trust it, you're not going to prescribe it. So the only way you're really going to trust it is if you have a hand in it. If you can see that algorithm, you actually put the input, you work with the developers to help refine this algorithm. That's what it's going to take. A lot
in the bigger context. I mean, like the belief has to be that we are created to repair ourselves. Mm-hmm. The less the doctors do, the better it is. But the data and augmenting the data and personalizing the data is the key for this whole process. And to put at it, we talk about this lipid numbers, this LDL, which is not the really a good marker, but there is a lot more different markers that come into the picture. So I'm learning all this, and I just want to put all these ideas into something that we can do, which is going to change the whole process of care delivery. Simple, if we don't want to do all this, a simple measure is the ratio of the circumference around the umbilicus to the height. It has to be less than 0.5. So that is one simple measure. We don't need all the apps, but maybe we can include it in the app. Like say, take the measurement around the umbilicus and your height in the same parameters, either centimeters or inches. And if it is getting better, it has itself been shown in studies that by itself, when it is 0.5 or less, it will contribute to your wellness. That is one simple thing. So,
and when we're talking about simple things, that's all it takes. For the majority of people, it's just simple decisions to do better things. I mean, that's what it comes down to when you look at the determinants of health. One of the big factor in your health is your personal decisions. It starts with the decision to do right or wrong. I'm not saying like black or white, but the decision to eat that or this usually leads to, if you choose something better, it leads to better decisions downstream. If you choose something bad, it kind of leads to worse decisions that way. So I mean, it all starts with simple decisions, and that's one thing that I want to really make clear to all this is really start at the top. I say at the top, or start with the simplest decisions possible and help people to go and get them started in the right direction first. And not try to overwhelm people with all these statistics and all kind of things they should do, but just start with those simple things of just walking more, getting better sleep. That would solve a lot of problems. just those two. If we sleep better, I guarantee that.
There's a whole lot of things about circadian rhythm, the circadian rhythm and sleeping. And there's a guy in California, Indian guy. His name is Dr. Sachin Panda. And you might want to look him up. There is an app for that. I mean, in fact, I downloaded their app, and it is so damn hard to work with it. And it's called My Circadian Rhythm or something like that. It's right beside Humantiv. You see that in my phone? It's like my circadian clock. It is interesting. It is very there, but there's a lot of problems with it that I had my own interactions with it. So I mean, it has to be a lot easier than that. I mean, so I can come up with all these and talk about all this, but I mean, like, we can have, say, every 2 months or every month, we can have an alarm saying, did you measure your circumference and your and height in every 4 months, every 4 weeks, and see whether it is changing or not. Until now, we do it by pant size, like the belt size or something, But then that is the simplest of all of them that I've seen.
Before too long, we're going to have smart mirrors. You just wake up in the morning, spin around, it's all measured for you.
Oh yeah, but then that is cost. I mean, like, that's not easy. I mean, like, I know all about it, where you stand in front of the mirror and this whole thing happens, and right now, Fitbit, even right now, I'm able to stand on my Fitbit scale every morning, and I know my percentage of fat from what they do. I don't know how reliable it is. You know what I mean? I don't think so. But then I have a bioimpedance machine in my office, which I can use, and I check that. So it's like, then all the data needs to be pulled into the system. So, but then it's the bioimpedance machine is $10,000, which is in my office. So you cannot expect somebody to get this accurate thing. So,
I think this is really good, because like you just said, there are some really easy metrics that can infer a lot about your health. And those are the ones that we need to work with physicians and doctors, to include in this app, for example. But on the other side, from our side, what we're doing is generating this personalized data, around a lot of metrics that a doctor can look at. And what you were saying about having doctors, basically the human body, the doctor will prescribe more exercise or more devices than medication. It goes in that sense, where we give you a lot of data, so the doctor would know a lot about the patient, and that data is all, live. It can be live, which can be like gathered through a long amount of time. So I think it's really powerful. We're giving back to the doctors, at the same time having the doctors look at all this data and prescribing some really personalized, things to the patient.
I do agree, Bill. And Dr. Ravi, the Quelth, the one that you sent me, I just kind of was tapping through just random stuff. I was overload. I'm
doing it right now.
Yeah, I'm sitting here just randomly just tapping. I just want to just see what it looks like to the end. That's too much. You can't expect somebody to do that. And that's where proper user interface design comes into place. You could just break it into 10 bite-sized chunks. Here are 10 questions, and it's going to take you 2 minutes. Do that today, and we'll pay you. You'll earn 10 Medit. And then maybe a week later, prompt them again. Hey, here's another 10 questions. You got 20 minutes to do it, so just start whenever you want to, or something like that. And it's that just comes down to design and user interactions. But that is what we're doing. So if anybody else, if y'all have any more comments, let's go ahead and do it, or I can go ahead and stop this broadcast and just kind of have a team meeting after this.
I think it just can't be overemphasized enough to just how much we're different, and especially in terms of data ownership. And we've had so many questions this past week about, oh my gosh, I'd love to join you, but I'm very worried about what you're going to do with my data. Big brother, is this some sort of government, conspiracy, whatever it is. And I think that we're just, what you see here with us is what you get. We are just average everyday citizens, and we want something better for everyone. And of course, all of our data right now, there are not a lot of policies. In Europe there are, but here in the States there aren't. So I think just know that we are different, and your data should be yours. In fact, there's a whole bunch of companies too. Humantiv, they want that to be your 31st human right. Actually, is that's your data. You own it, and you should be compensated for it. We align right with that. So the best way that we can prove to you that this is what we want to do, is to show you that we are different, and that basically we are in it for your health. We're vested in your health and your well-being, and that is what we are all about. So I just don't think that can be emphasized enough, is that's your data, and you own it.
You're going to make some money off of it too.
Yeah, exactly. So.
All right. Well, if anybody is still with us here, once again, you can go to citizenhealth.io/Humantiv. If you go up to our developments, there's a drop-down menu, click on Humantiv, and you'll be taken to the page kind of explaining this a little bit with a beta registration form. So go ahead and register there, and you'll be rewarded $200 worth of Medit for your participation. And probably the day before, which is a Tuesday, we'll probably have a webinar like this with all the people who are participating. Just kind of go over what to expect, to look for, what's coming in the pipeline, and so forth. So thank you for your participation, and look forward to working with you. All right, everyone. I'm going to stop this broadcast now.